I want to start this video with something that just happened to me. At age 68, after nearly 2 decades on hormone therapy and with excellent health markers, I was told I could no longer continue my hormones within my health care system, within my HMO. Nothing about my health had changed, only my age. And it made me realize something much bigger is happening in the menopause care space, not just for me, but for millions of women, especially those in their 70s and their 80s. Our moms and our aunts who were never part of a menopause conversation when they first went into menopause and have not been brought back into the conversation, even though the conversation and science has changed. I think a lot of people have been lulled into believing that menopausal care is being adequately addressed. But here's the reality. Only about 5% of menopausal women in the United States are using hormone therapy. That means roughly 95% are not. And that means many women are needlessly suffering. And again, for many women, those over the age of 60, the conversation about menopause care never truly happened at all and isn't going to happen unless we do something about it. In the early 2000s, after the Women's Health Initiative study, fear around hormone therapy became palpable. Prescribing dropped by 70% overnight. Physicians were taught to avoid hormones whenever possible. Medical education shifted away from menopause almost entirely. And for more than 20 years, most clinicians received little formal training in this space. Now, this isn't about bad doctors. It's about doctors practicing exactly what they were taught during a period of uncertainty. And again, at age 68, after being on hormone therapy for 18 years and probably being one of the healthiest patients my doctor sees, I was told I could no longer continue it, again, within my healthcare system. She would not support me nor prescribe. End of conversation. So now, if I want to continue a therapy that has supported my health for nearly 2 decades, I have to step outside of my HMO and pay out of pocket to see a doctor who will prescribe hormones for me. And in California, that's about $1,500 out of pocket per year to cover being seen by a physician, getting proper labs, plus paying for my hormones. And I can do that, but many women cannot. And that's the part that has stopped me in my tracks. Because this isn't just a medical issue, it's an access issue. For the past 5 to 10 years, menopause has been treated primarily as a symptom problem. But once the symptoms are gone, you're supposed to be good to go. The questions have become, are you having hot flashes or something wrong with your vaginal area? Can you sleep? But instead of asking these questions, maybe we should be asking these questions. What is happening to a woman's heart, her brain, her bones, her joints, her metabolic health, her urogenital health, and risk of recurrent infections? The loss of estrogen contributes to increased cardiovascular risk, accelerated bone loss, cognitive and sleep changes, joint pain and inflammation, metabolic shifts, and genital urinary symptoms of menopause, including recurrent UTIs that are often underdiagnosed or not diagnosed at all in older women. And that can become a problem because that can become systemic, affecting her kidneys as well as affecting her brain. Neither estrogen or progesterone were ever just about reproduction. They are system regulating hormones affecting nearly every organ system in the body. Yet many women are never even offered a discussion about options, including the use of hormone therapy to stop so many of the debilitating conditions that send women to losing independence and suffering in their later years. When discussion disappears, informed choices disappears with it. So why do practitioners hesitate? Most physicians are not withholding care intentionally. Their hesitations are actually understandable. They were trained during a time when hormone therapy was considered broadly risky. They worry about causing harm. They are not informed. They face liability pressures. And they work inside healthcare systems designed around standardized policies rather than individualized longevity care. Most were never taught differences between oral and transdermal estrogen and their differing risks. They were not taught the distinction between bioidentical and non-bioidentical and newer safety data, and how continuing therapy is supported by organizations like the American Menopause Society, and even how starting later in life can still offer huge benefits, and those benefits safely. So again, this is not about blaming doctors. It's about recognizing a system that hasn't fully caught up with the evolving science. And I'm not sure it will for another 10 plus years, even with all the press surrounding perimenopause and menopause and hormones that is currently going on. And unfortunately, the women most affected may be our mothers, our aunts, and our older neighbors who were told that their symptoms were simply aging and they got to put up with it. They are continually told time and time again that hormone therapy is dangerous at their age, all without a real discussion or understanding. And again, not because care doesn't exist, but because the conversation quietly stopped. Now, just to be clear, this particular video isn't about hormones being right for everyone. Some women should perhaps not take them. Some women choose not to. And that's completely valid. But every woman deserves updated information, individualized assessment, a conversation, and the opportunity to decide what quality of life means to her. My work is not about telling women what they should do. It's about helping women understand their options, ask better questions, and participate fully in decisions about how they want to age. Because every woman deserves informed choice, compassionate care, and the opportunity to move through the second half of life with strength, clarity, and